So I think that's probably long enough for us to wait for us to start. So for those that have just joined, my name's Connor Moore. I'm an academic F2 in Severn Deanery, working with the Centre for Surgical Research. This webinar series was introduced to widen sort of access to information about the Academic Foundation Programme. And this is the first in a series that we're going to be doing again this year. So the agenda today is I'm going to give you a bit of an introduction into what the Academic Foundation Programme is, and a little bit about my experience so far. And Professor Hinchliffe, who's the head for the surgery AFP that I'm doing in Severn, has kindly agreed to give a talk about his career and sort of what his opinions on the Academic Foundation Programme are. And we've got a few people from around the UK to give sort of a more general experience about what their Academic Foundation Programme was like. And we're going to have a bit of a Q&A at the end. So this is just some key dates and everything that we're going to be covering this year, if you're not familiar. So we break down all of the different aspects of the Academic Foundation Programme and sort of teach you how best can you maximise your chance of getting in. And in this webinar, we're mainly going to be talking about, sort of what it is, why you'd want to do it, where you can do it, what are the key dates, and how you go about it. So I think first thing to address is that there's been a recent sort of renaming of the Academic Foundation Programme to the Specialised Foundation Programme, which is in the process of happening this year. And it is essentially the same thing. The application process is going to be the same. And I think the renaming really in principle has come as a result of better representing the leadership and education components of the Academic Foundation Programme rather than just research, even though predominantly that's what the posts offer. So there's quite a range of you that are attending today from sort of year one to final year. So for those that aren't aware of what normal foundation training is for sort of the early years, that's sort of when you graduate from med school, across 2 years, you'll do 6 4-month clinical rotations that will help you sort of gain competency and understanding of how to operate as a doctor before you enter specialist or general practice or core training. So this is your typical example of foundation training, which will have these 4 different rotations. So in terms of getting there, you'll have your educational performance measure, or your EPM score, which is a score out of 50, 43 points of which is from your performance in medical school. And that's something that we all work on to do as well as we can. And the additional 7 points is from extra degrees like intercalation and sort of publications and prizes. I think recently that's changed this year to not include intercalation, but you can still get points for sort of publications. So the SJT is an exam that everyone does in their final year, which assesses on sort of general sort of competencies in medicine in terms of how you think and how you make decisions. And this represents 50 of those 100 points that you need to rank best for your foundation training application. So what then happens is that you get a score out of 100, you rank all of the deaneries in the UK, you then get allocated to a deanery based on this score, and then you have to rank jobs. And it's a bit of a sort of a gamble in terms of what jobs you're going to get. So academic foundation training is another route that you can do, which is different in the way it offers dedicated research time or dedicated time to education and leadership activities. So the most common format is where one of your 6 4-month rotations is replaced by dedicated research time. But this varies sort of between clinical day release and other formats, which I'll discuss. So the Academic Foundation application is different to the normal foundation application and happens before. So it takes into account your EPM score in order to shortlist you for an interview. And then you also have additional things like prizes, publications, presentations that you can help to shortlist you for this interview. And some of the deaneries or academic units of application will allow you to write a little bit about yourself in the format of white space questions, which is sort of like an essay that you would answer in sort of 5 different questions or 3 different questions that are 200-word responses. And then you can go for the interview, which is sort of done sort of around November, December of the application year. So the AFP application is quite different, it's quite involved, and there's not a lot of transparency about how you'd maximize your chances of getting a job. And that's sort of where the core of this course came from, is to try and help give you guys that information and break it down. So this is sort of, again, different variations of how the academic time is presented. And you can have sort of academic day release or dedicated research time. So what is the purpose of the Academic Foundation Programme? So it's initially been developed to sort of give people an exposure to research, and then it's sort of been developed into exposure to leadership and educational activities. So it can form part of what's known as the NIHR Integrated Academic Training Pathway, which both Sophia and Giselle sort of are on the track of at the moment, that are our speakers today. But it could also just be a chance for you to experience research if you haven't done loads before and see, is this something for me? And you can always enter into a research career or a leadership career further down the line. So there's a few different types available. You have research, which is what Seven offers exclusively, is research AFPs. But there's also medical education, leadership and management, and it varies in which deaneries and which academic units of application sort of offer these. So something that's, oh, I think somebody's speaker is just going off. So something to bear in mind with all of these things, if you're thinking about doing it, is that doing a research style academic program or a medical education block does not exclude you from doing these other things. And actually they all fit quite nicely together in sort of what makes up what you need to be for a clinical academic, which is, you know, what the sort of GMC Future Doctors is looking for all doctors to be, is sort of a combination of a teacher, a researcher, a leader, as well as putting their patients first. And so it can really help you sort of in lots of different ways, and it's not exclusive to what program you do. So there's a few different pros and cons for why you'd want to do one of these programs. So there's a chance to get more experience than you'd otherwise have. You have dedicated time, and the main thing for me really is access to a team of academics that are sort of supporting you and sort of have your interests in mind. And there's a few different things to consider in terms of cons, which are important during your final year. So it's quite difficult, the application process. It can be quite time consuming. And when you go further into sort of your F1 and F2, it can be a bit more demanding to balance academic or leadership educational activities around your clinical time. But I think for me, really, I got quite a lot out of it, even without the dedicated time in my F1. I've done teaching, so I've co-founded this national teaching course. I've been able to do QI projects. I've done a research project that's resulted in outputs. And this is thanks to that network of academics that I've had access to from doing this programme, which you would get all across the UK. So where can you do it? So there's 15 different academic units of application, and they're all listed. We're going to have a website put up in the next week or so, which will sort of help you sort of get a bit more information. But there's also the UK FPO website, which we'll link to later on. In the application process, you can only select two academic units of application. So it's really important that you think hard about which places you want to go to, and we'll sort of talk about how you'd select that in further webinars. But essentially it comes down to a personal decision about where do you want to be, who do you want to work with, and what research do you want to do, or what educational activities you want to do, and does that place match up with those things.
Great.
So there's a few key dates that are ongoing for this year. So this is from the Northern AFP website, and you can see a few key dates there, but there's also on the Specialised Foundation Programme page. So we sort of run our course in sort of association with that timeline, so you can get the most information before your actual application. So there's a few key things that you need to sort of do before this application. So first of all is decide, do I actually want to do it? If you're in your early years of med school, this is a really good time to sort of think about it and maybe build your CV, get that experience and say, do I like research? Do I like education? Do I like these leadership activities? And if you're in your final year, you've still got opportunities to do that before your application. And what we do is we sort of provide sort of tips on how you'd get these things. We're going to give detailed advice on how you'd ace your white space questions if you're choosing deaneries that are doing that, what deaneries to select. And as well, we're giving sort of tips on the interview process, and we're even running mock interviews later this year, which were really successful sort of last year. And this is all for free. And I think the key message that I'd like to sort of put across is why wouldn't you apply? It's a little bit of time and a little bit of effort, but you don't lose anything from applying. And it may well be something you really enjoy. So don't be discouraged if you feel like your CV isn't quite there, because there's a lot of people that have sort of got onto academic programs that wouldn't have publications, had not had that many presentations, and may not have been the #1 decile in med school. So it's important to think, lots of people can do this. So here are the key dates, and we're going to sort of put the sign-ups at the end of the webinar. A little bit about me, I've already sort of spoken about myself and what my interests were. So frequently asked questions. So we had sort of a few sign-up questions that we're going to go through. I think Antonia and Maya should have been responding to those in the chat. So we're going to run a proper sort of full Q&A at the end. So now I'll just introduce you to Professor Hinchliffe. So he is the lead for the surgery AFP at the University of Bristol and North Bristol NHS Trust. He's a professor of vascular surgery, and he's one of the lead editors on the BJS. He's been very helpful and supportive to both me and another colleague at AFP this year in supporting with this course. So it's my pleasure to introduce Professor Hinchliffe for his talk on his career.
Okay, thanks, Connor. I'll just share a slide if someone can disable their host participation.
Yeah.
Hang on a sec. I'm not able, it says host disabled participants.
1 second, you should be able to now.
Okay. So, yeah. A career in clinical academia, I think I'd just like to thank, the sort of enthusiasm of Connor and Kitty, really, which got this off the ground, and it's really excellent initiative. And certainly I wish I'd had something very similar at the stage of probably most people who are dialing in. This really is the academic training pathway, and we can certainly talk about that later, and Connor's kind of already gone over that in some detail, but it will be something that will be brought out on the course over the coming weeks and months. And I don't want to dwell too much about the sort of specifics of this, although we can talk about some aspects of it. I just want to give you really a flavour of what it's like to be a clinical academic, at least my view of what it's like and my life. I don't want to drone on too much about the specifics of what I do and what I've achieved, because that's probably not too relevant to most of you. I'm a vascular surgeon, I have my own dedicated interests, but I'll probably bring out a few sort of hopefully useful insights, what you can do to position yourself well to be a successful clinical academic, how you can prepare yourself, what life looks like, what are the challenges, why you should do it, and perhaps why you shouldn't do it. So before the clinical academic training pathway was developed, and it was developed really probably in about 2005, 2006 with the Modernising Medical Careers initiative, and a chap called, who's now Sir Mark Walport, who's one of the chief scientific advisors recently, set out a dedicated pathway for clinical academic training. And prior to that, that really didn't exist. So when I qualified in 1996, this simply just didn't exist. And the way to become a clinical academic was really opaque. And what was happening in the UK was that we were hemorrhaging really top-level clinical academics to other places. Our clinical research was really dropping down the pecking order, and there was a decision, a strategic decision to try to address that. And that was done in combination both with the Modernising Medical Careers work, with the integrated academic training pathway, and the development of the NIHR, the National Institute of Health Services Research, which really pump-primed a lot of the large clinical trials that we're all aware of, and a lot of really high-level, high-impact clinical research. And prior to that, really, there was not much going on. And for example, within academic surgery, it was a real struggle to get any surgical research funded, and many surgical research departments were really on their knees. This has really revolutionised that. And probably what you've seen, I suppose, as undergraduates looking at the COVID pandemic, a lot of the high quality research that's really revolutionised the way that we've managed this horrible disease has really been funded by NIHR and by those people who've been sort of brought up through the integrated academic training pathway. So, but times are changing. So, you know, this has been really available now for a number of years, and many people who started on the early within the academic foundation programs have really matured into professors of medicine or surgery or whatever. And I think really it's given a great opportunity to people from really diverse backgrounds to develop themselves as good clinical academic training within a good clinical academic training path. What does my job look like? Well, I happen to be a vascular surgeon, and like many clinical academics, I've got to be responsible really to two major bosses. One is the university, and one is the NHS, or my NHS trust. I have to have an appraisal for both of those bosses every year. So, you know, it's a challenge. You have to try to balance clinical work and research work, whereas your NHS colleagues have just got their clinical work. Obviously, they're busier clinically in terms of the numbers of activities that they do, you know, numbers of operating lists and the numbers of clinics and calls are greater than I do, but they don't have the research commitments. And similarly, some of my colleagues in the university who are whole-time researchers have more research commitments and fewer clinical commitments. So it's a compromise, and either it's either the best of both worlds or the worst of both worlds, depending on which way you look at it. I happen to think it's the best of both worlds. But clearly I have responsibilities to supervise students, I have teaching responsibilities, I have leadership roles to develop new courses, to lead grants and development of grants and new research pathways. And as Connor quite nicely showed, it's really a sort of Venn diagram really of research, of surgical education or clinical education, and leadership. And in any clinical academic, some people may well have larger components of research compared to those other two things. Other people may have really stellar leadership roles, and it's a balance. And as you develop as clinical academics at different times, even different times in your career, the size of those individual circles may increase or decrease depending on what and how you want to shape your career. So why do you need to do it? Well, I think the first thing about medicine and your career, it's got to be fun, it's got to be enjoyable. So if you're going to go into this, you've got to get some enjoyment out of it, of course. And you know, life can get quite serious, but you know, it's going to be something that you're going to have to do for 20, 30, 40 years, perhaps longer. And you've got to get some enjoyment out of it. So if you're going to go into it, you've got to really think you're going to enjoy it. I do. It's certainly challenging at times, but it's got to be something you get something out of personally, as well as this sort of broader benefits to patients and society. It's challenging, and the reason I went into it was because I like to try and challenge the dogma. You know, we often treat things in the same way and have treated things in the same way for a number of years. And I often think, or I often thought when I was quite junior, that we often didn't reflect on why we were doing things. We were simply just doing things in the same way for the same reasons, and often getting poor outcomes and never sort of standing back and reflecting how we might want to change the practice of medicine and the way we treat patients. So for me, that was a big driver to become involved in clinical academic training. I think the advantage that you have often over clinical colleagues is that you can have interactions with really impressive people, often out of your own sphere of specialism. So you often deal with people like epidemiologists, public health medicine consultants. You often deal with those completely outside of medicine. They may be mathematicians or statisticians. They may be those involved in leadership and business. And being a clinical academic, you do get the opportunities to develop those things. Because the problem with clinical medicine, and I see this all the time with my NHS colleagues, it really is a conveyor belt. You know, the patients keep coming and you do the same or very similar operations. And of course, it can be challenging. The operations can be challenging. The clinical scenarios can be challenging. The treatments can be challenging. But it really is a sort of continuous treadmill. And I saw this, I often see this in colleagues. You become very absorbed in sort of the pathway. You don't have the opportunity, like a lot of clinical academics do, which is to stand back, to review exactly what we're doing, and have the opportunity and the time within your program to be able to influence change. And I think the other advantage is that, you know, if you do have any desire to influence what happens in future, being a clinical academic is a great opportunity to do that. How do you do it? How do you get involved? The key thing for me, again, I mentioned, you know, medicine's hard, and you have to get some fun and enjoyment out of it. But as a more senior clinical academic, people coming to me, young doctors, medical students, I'm looking for the enthusiastic ones. You know, it's really great for me if someone comes who's enthusiastic, they're inquisitive, they start to question things, they really have a sort of an enthusiasm, and that's what I'm looking for. And I think for you who may be concentrating or thinking about a clinical academic training career, then you need to find and engage with clinical academics, and there are plenty of them in every trust or in every university in the country, and they're the ones with the good track records you should be approaching. Drop them an email. You know, yes, sometimes you don't get a response, but actually more often than not, people are only delighted to receive emails of enthusiasm. There are lots of opportunities now, you know, using the internet to be able to see what opportunities are on offer. So if you're if you have interest in surgery and want to be a surgical academic, you can go onto the various AFP websites to find out who's doing surgical research, see what they're doing. You know, most units now have their own websites. You can see what activities are taking place, and you can get involved in that. And most people are really keen to engage with medical students now, really keen to engage with young doctors. And then you'll start to see what's happening. You'll get a flavour for what sort of people are involved, what they're doing, and whether that really fits with what you've got an interest in. The other thing I think that you should consider really is how can you pick up skills that are going to benefit you further down the track. Most people come out of medical school with a very similar CV. most people who come to consultant interviews have a bunch of core skills. They'll have their MRCS or their MRCP or their FRCS. But actually, I think people are looking for something extra. So you've got to consider what skills can you offer to an AFP program which make you stand out. And that's relatively easy to do now. There are lots of things like short courses. For example, in my university, there are short courses on qualitative research, which are relatively straightforward to do, or statistical analysis, or public health or epidemiology. And picking up those skills are both useful to you personally, but also make you stand apart from other people. So getting involved in departments, going along to find out what's happening, picking up skills as you go along are really important. And the other thing really you should consider, people talked about how to increase your CV and improve your CV. You can do that, of course, and it's important to do that, but you must remember that you've got to try to identify and focus on successful projects and avoid wasting your time on those where they're unlikely to bear fruit. And the way to do that is to identify and associate with people who are successful already. And you can do that by identifying those who are involved in the AFP programs, and also by looking at people's Google Scholar output, for example. But remember, it's really important to plan well in advance, and Connor alluded to this, that it's very difficult to influence your CV overnight. And a career in clinical academic medicine is something that's really a marathon and not a sprint. And it's all about planning and having the foresight to think, okay, well, what do I need to get to be competitive to be able to get onto these various academic foundation programs? And if you don't get onto an academic foundation program, that's not the end of your clinical academic training career. There are opportunities later, as you can see within the ACF program or the clinical lectureship program. It's just a slightly more difficult route to get into clinical academic training. What are the barriers? I don't think there are barriers these days. I think, there are so many different opportunities now in many aspects of medicine, whether you have an interest in the biology of disease, whether you have an interest in the epidemiology of disease, whether you have interests in innovative treatments, or working with even with industry. There are so many different opportunities, but remember, like many things in life, it's competitive and very highly so. And every time I go to the AFP interviews, I'm always quite amazed by how impressive our junior doctors are, starting out so much better than I was. But that's life. It's competitive, and it's always about compromise and a sort of a balance. And you remember, you've got to balance on the one hand your clinical medicine, on the other hand your academic medicine, and then everything else outside of medicine, which is really still very important to maintain your sort of level-headedness and your ability to do the other two aspects of the job. So it's always a balancing act, but there are certainly plenty of opportunities now. But make no mistake, it is very, very competitive. So there are lots of challenges, but I looking back at my career, I've thoroughly enjoyed it. I am continuing to enjoy it. And remember, embarking on your medical career, it should be something that you enjoy, because as I mentioned earlier, it's something that's going to sustain you for 30, 40 years. So the main thing is to enjoy it, make sure you're organised. But thank you for dialing into Connor and Kitty's AFP introduction, because I think it's a fantastic initiative. So thank you, everyone, and I hope you enjoy it. I'll be happy to answer questions, and I'll hang on, and we can hopefully answer some of those in the Q&A. So thank you very much.
Great, thank you so much for that, Rob. I'll just share the other screen. Let's see where it is. Great, so that was a really great talk. Thank you very much. So we're going to be moving on now to the sort of panelist session, where we've got three junior doctors to talk about their different academic careers. So the first person to talk is Dr. Luke Weston. He's an AF2 at Oxford, and he's got an interest in orthopedic surgery and has done lots of different work in surgical simulation research. So Luke, would you like to take the floor?
Thank you very much. Thanks, Prof. Hinchliffe. That talk's very interesting, and thanks, Connor, for having me. So, hi, I'm Luke, as Connor said. I'm currently an AFP2 at Oxford University, and yeah, my kind of main academic interest is in kind of simulation, surgical simulation. So I'm going to just spend a few minutes talking about why I kind of got into the AFP, what I've done so far and why I think it's a good thing, and then also some of the challenges that I've had. So yeah, so I'm doing it at Oxford, and I kind of wanted to get into doing the academic foundation programme because I had some research experience during medical school and I really enjoyed it. I did my intercalation and did some simulation research there, and I kind of wanted to do more, basically. And I knew if I was doing, you know, a full-time foundation program, actually it might be quite difficult to do this extra research, and especially, you know, in kind of simulation, you need a bit more like full-time, being in a lab, doing, you know, studies and things. So I wanted the opportunity to kind of continue that interest. So that was kind of my main motivation. And then thinking more long-term, there's a possibility that I want to become a clinical academic, and doing the AFP is really like the perfect kind of testing the water to see if you actually like having that split. There are lots of challenges associated with it, which I was aware of, and Prof. Hinchliffe has talked about a few of those. And basically you have two bosses and you have to compete highly in both, so it can be a big challenge. So I just wanted to see if that was something that I could manage and something that I enjoyed doing. So far, yes, I'm enjoying it. And then particular things that drew me to Oxford. So obviously they have, you know, quite a few interesting teams that work here. They had a surgical simulation team which attracted me, and Oxford's a bit unique in a way compared to some of the other AFP programs in that their projects aren't themed. So I have 4 months, which I'm just starting now, and essentially they let you do whatever you want, which can be a good and a bad thing. I think you have to be quite organized, and, you know, you have to find your supervisors and sort basically everything out yourself. But it does give you the freedom to do whatever you want. So if you have a specific academic interest, so one of my colleagues, he's really interested in pediatric surgery, and you know, there's not really many AFPs where you'd be able to do a pediatric surgical project. It might be quite difficult. So Oxford allows you to kind of do whatever, so that's quite good. So what have I done so far? So I've just completed my F1, and during that time, one of my rotations, I had some day release. So 1 day a week, I had some academic time, which was really useful. So I actually got involved in a little bit of work last year. So I managed to publish a small paper. I got involved in the recovery trial. I met one of the kind of PIs, Raha West, who kind of was leading a lot of the work in this region. So I was recruiting for recovery, which is, you know, one of the largest RCCs that's ever happened. So that was really good opportunity that I got to do last year. It's allowed me to do some reasonable audits in my hospital and create some change, and also work on a project kind of part-time through that year as well. So I've had a lot of opportunities which would have, you know, I possibly could have done it if I was full-time F1 in clinical medicine, but it definitely would have been more difficult. So just having that little bit of time was really great. And now this year, I'm kind of finishing off a few of those projects I started last year, and now I'm working full-time at the Nuffield Orthopaedic Hospital in the simulation lab. That's really great. So I'm working with a really interesting professor who's really, you know, nice and supporting me. And I'm also doing some training and research modules and courses and stuff. So yeah, there's a lot of really great opportunities that you get from doing the AFP, and a lot of, you know, unique people that you wouldn't necessarily come across otherwise, which Prof Hinchliffe has also talked about. You know, you meet people from, you know, different backgrounds, different interests, you know, working in the lab. There's people that are there full-time doing research nurses, admin people, statisticians, you know, all these people that you wouldn't meet if you were just doing your clinical work. And it allows you to kind of step back and think about things a bit differently. So I quite like all of that stuff. So that's really why I got into it, and why I'm doing it at Oxford, and why I think Oxford's a great place to do it as well. And then there's a few things that are definitely a bit difficult about the AFP, and that you should consider your situation. So obviously there's a bit of an application process, but hopefully this course will take you through it. And to be honest, I think all the work that you do working towards getting into the AFP, you have to do that work when you're looking at specialty applications anyway. So if you get your CV in order and you start thinking about this stuff earlier in medical school, you know, it's work that needs to be done at some point. So I wouldn't worry too much about the application process. And, you know, the acute medicine stuff you have to learn is also relevant for finals if you're doing those. So the biggest downside for me doing the AFP is that the medical rotations are a bit more general. That's just because you have to get, you know, your core skills covered, just like every other foundation doctor. So you tend to do more like general rotations, like general medicine and general surgery. And I'm personally someone that's interested in specialist surgery, which, you know, you wouldn't tend to get on the academic foundation program. So just bear that in mind. But having said that, I think if you want to do those careers, there are opportunities to get that experience, you know, outside of your foundation program. For example, I'm going to be locuming in my, you know, my chosen direction over this following year anyway. So you can get that experience. And then it can be a bit stressful. So I'm kind of one of these people that picks up like lots of small things, and there's a lot going on in the background. And you've also got all of your clinical stuff, and you're learning loads as well. So it's quite a busy time. So just bear that in mind if you're someone that gets stressed easily, but it's all very rewarding. So yeah, so that's kind of me and what I think about the AFP. So I can answer some more questions later, presumably in the Q&A.
Thanks so much for coming today, Giselle. If you'd like to take the floor.
Hi there, my name's Decile. I'm an academic clinical fellow in general surgery based in the Severn Deanery. So just a bit about my academic experience so far. So I really started research in about third year of medical school, so getting involved in a BSc and also student selected components, which gave me a lot of experience in research. And when I found that I really enjoyed surgery and the academic side of it, I applied for the Academic Foundation Programme in Bristol. So I completed the AFP in surgery here and was supervised by Professor Hinchliffe. And one of the reasons that I applied to Bristol is, you know, I found that when I was looking through the different academic programmes across the country, Bristol is very organised, where you get your 4 months of your academic block and you get a day release during your clinical rotations. But within your academic days, the university has organised teaching sessions, which really helps you develop the academic skills, you know, statistics, systematic reviews, and also teaching to really help to maximise, you know, what you need to know as an academic clinician, which I thought was very useful. You also get to work with very supportive senior academics during your time as an AFP in Bristol. So as someone who's just started academia, when you're in your foundation training and you've finished medical school, I found that what you really need is someone senior to direct you to, you know, how you can maximize good output and really show you whether this is something that you want to do in the future and something that you really enjoy doing. I enjoyed doing the Academic Foundation Programme. I thought that it was a good way to focus on things that you were particularly interested in, meet really inspiring people, and I found that it was so rewarding, which then directed me into applying for the academic clinical fellowship in the region. So in terms of what I did during my AFP, I got involved in a couple of systematic review projects which have now been published. I led a project as part of a national collaborative in robotic surgery. I did some courses, so in Bristol you can do short courses on top of your teaching courses. I also became quite interested in sort of trial design and trial recruitment during my clinical time. So I was involved in recruitment for things like the sunflower study, and also during the COVID pandemic, the recovery trial. So I tried to get involved in a few more courses to help me with patient recruitment and learn a bit more about trial conduct and design. And I also got involved in some quality improvement projects that I presented nationally and won a prize for it. And as a previous speaker said, you do have to plan ahead of time, and if you are interested in going further on into an ACF, you do have to dedicate some time into tailoring your application to be successful at the next stage. And also, I think the AFP in a way is something that you can use because you have more flexibility with your time to really develop skills that you can offer that makes you stand out, and also, you know, can put you in a good position into an academic career in the future. So yeah, and why did I carry on with academia? I really enjoy it. As it was said before, you know, when you're doing your clinical time, it gets very busy. I certainly have experienced this starting my core surgical training, where you see a conveyor.
Has her audio just gone? Yeah. So we'll just give Giselle a moment to reconnect. So I think Giselle was probably reaching close to the end of her talk. So I think probably just in this interest of time, we will carry on. So thanks very much to Giselle for that talk. Hopefully she can join back for the Q&A, but obviously experiencing some technical difficulties at her end. So I want to say a big thank you to everyone that's come today to do a talk. It's been really, really great to have you all. And I hope that's been useful for everyone that's sort of interested in the AFP and finding out a bit more information. Oh, Giselle, are you back?
Yeah, sorry, I don't know what happened there. It seemed connected. Really sorry.
Did you have anything left to say to close?
No, I just no.
No, that's okay. Well, thank you so much for coming. Really appreciate that. So as I was saying, so this webinar series is developed to cover all aspects of the application process to the Academic Foundation Programme. So we hope that this session has given you a bit of a taster of different experiences of the Academic Foundation Programme in both Severn Deanery and Oxford. The next webinars will be sort of going through these different stages, so tips for how you'd improve your CV and how you'd get research and leadership and education opportunities, how to improve your why space questions, and also the sort of big meaty part, which is the interview, and how best to do that. And we're even running mock interviews sort of going on into the year. So what I'll do is I'll leave the feedback form up whilst we do a bit of a Q&A session. So if anyone has any questions for any of the speakers, so we've got everyone here, if you could just put it in the Q&A section and then we can read out some and answer them.
So we've got a couple of questions here already. So one is, what is the advantage of doing a med ed AFP over just doing F1, F2 and teaching, or doing a clinical fellow year?
Okay, so I think as one of the key messages that you guys may have got from all the speakers today is that the advantage of the academic or specialised foundation programme is that dedicated time. And once you start working as a doctor, time becomes a very, very precious thing. And by having that time, whether that's a day release or that's a 4-month block, it really gives you that space to develop something really meaningful and sort of useful. And that doesn't mean to say that excludes you from doing it during F1 and F2, you know, without any academic time, but it is a bit easier when you have that time. But certainly you could very easily develop a teaching program as an F1, F2 outside of a medical education sort of academic post that could potentially be more have more impact than, say, something that a med-ed AFP does. And it's the same with educational based research. So for instance, I've done an educational based national survey, a research project this year, but I am a surgery AFP. So these things do not exclude you from getting these opportunities, whether that's an academic or a non-academic. You can do these things in your own time. Does anyone else have any input on that? No.
Kind of building on that, there's another question that is asking, what is the advantage of academic release days over the 4-month block?
So Luke, I think you're probably best placed to answer this, having had a mixture of the two.
Yeah, so mine had a bit of a mix of both. I think specifically you're talking about, so for example, I know that the programs in Oxford, so some of them you have a pure 4-month academic block in F2, but some others, for all 3 rotations, you have day release over the whole year. So I think basically I'd say it depends what you want to do with your time. So there are certain things where you will need full-time academia. So say, for example, my project's in simulation, so I need to be in the lab kind of full-time to do all of those studies because I need participants coming in, etc., etc. If you are planning on doing a more, a larger study which takes more time, is like a slower patient recruitment thing, you can look at data, through the whole year, then actually having a day release over the whole year as a more of a slow burn project is going to be more beneficial for you. So that's kind of like the main difference. So just think about the kind of research you want to do, and not one's not better than the other. You still have the same amount of like academic release.
Right. So I think there's one about decile cutoffs, and specifically the Oxford AFP and whether you apply an F1 or F2. So to clarify, the Academic Foundation Programme application is in your final year of medical school. So it's in conjunction with your application to normal foundation training. But you need to start your application sort of around September, October time is when the Oriel online system will sort of become available and you'll select your units that you want to apply to. In terms of decile cutoffs, I don't necessarily think that deaneries have a specific decile cutoff. It varies significantly between them. I think as junior academic foundation doctors, we don't know, quite simply. But what I do know is that the assessment sort of varies between places. I don't know whether Professor Hinchliffe, you'd have any perspective on that.
In terms of shortlisting or in terms of the interview, I'm not really sure in terms of the shortlisting. In terms of the shortlisting, look, I mean, you will go through that when you within the introduction to AFP program. But all I would say is it's pretty formulaic in terms of the points that are scored. I don't have those to hand, but those who shortlist are given very clear guidance on how to score. You know, there's clearly there's always some softer interpretation. And so I noticed some people have put in the Q&A about, you know, do things like first author and joint first author publications count and stuff. Look, I think sometimes those are very, very difficult to interpret, and it's unlikely that something like that is going to be a deal breaker because there are so many other points to be scored. So I wouldn't get too worried about the sort of specifics. You know, there are many other points to be scored, and one often looks at the kind of breadth of interests and clear, and sometimes the fit of the AFP programme with this individual as well.
Great.
So just to add to that, when I was applying anyway, in terms of the Decile cutoff specifically, I applied to London at the same time, and I think they were probably the only deanery in which they did specify a Decile cutoff in terms of the applicants saying, you know, we are looking to longlist final year medical students on third decile or above. So, or you could always look at how they processed the years prior to this but other deaneries were more, you know, as Professor Hinchliffe said, they look a bit more at the breadth of experience and the interview itself. So it's definitely worth looking at their criteria ahead of time, looking whether they require the white space questions as well, which a lot of deaneries do require you to fill out. I don't know if it's changed this year, but from my experience, that was what I found.
Great. So I think that's all we have time for, really. So we've reached sort of the end of the session. I think just to quickly answer, there's quite a few resources for critical appraisal. There's How to Read a Paper, which is quite a good book, and we're publishing a guide to critical appraisal on our website, which will be accessible from www.accesstheafp.com from the 10th of September. So that could be a resource for you to go to, and there's a number of different ones online. In terms of the structures, again, we're going to be covering this through our website on the deanery selection section. And with specific programme questions, I would refer to the university website. So I want to say a huge thank you to all of the speakers today for giving up your time to this talk. I hope you've all enjoyed it. Just before we go, I'll give the sign up for the next talk. And I'll be emailing all of the attendees with the sign up form. But if you could register now, and you'll get a certificate when you fill in the feedback form for the attendance to this programme. So I'll just leave that up for a couple of minutes. And if you could share within your medical schools and your amongst your friends, that this is all about widening participation. So it'd be great to get more people to sort of have access to this information. So please share, and we look forward to seeing you at the next webinar. Cool, I think I'll close it there, guys. I'll stop recording.